CO2 laser versus microneedling versus subcision. We're breaking down three powerful treatments for skin rejuvenation and scar repair: CO2 laser, microneedling, and subcision. Each of these treatments offers unique benefits for tackling various skin issues, including acne scars, wrinkles, and more. In this video, we'll compare these methods to help you understand which might be best suited for your skincare goals. Number 1. CO2 Laser Resurfacing. Starting with the CO2 laser, this technique uses a carbon dioxide laser to remove layers of skin tissue in a fractionated method, which leaves small columns of untreated tissue throughout the area. This promotes healing and reduces the recovery time. CO2 laser is excellent for treating deeper wrinkles, more significant sun damage, and prominent acne scars. The result is smoother, more uniform skin, but expect some downtime, typically about 2 weeks of healing. Number 2. Microneedling. Next we have microneedling. This treatment involves using a device equipped with small needles to create micro-injuries on the skin's surface. These injuries prompt the skin to produce collagen and elastin to heal, which naturally improves skin texture and firmness. Microneedling is less invasive than laser treatments and is ideal for reducing the appearance of fine lines, minor acne scars, and enlarging pores. It has minimal downtime, with most patients experiencing only minor redness for a few days. Number 3. Subcision. Subcision is a specialized procedure used primarily to treat rolling acne scars. A small needle is used to puncture the skin, and then it's moved back and forth to break the fibrous bands that are pulling the skin downward and creating the scar. This treatment releases the tension in the scar, allowing the skin to lift and smooth out. Subcision can be very effective for deep, tethered scars and usually requires several sessions for optimal results. Downtime can include bruising and swelling for up to 2 weeks. Number 4. Comparing treatments. Effectiveness. CO2 laser provides comprehensive resurfacing, making it great for severe skin issues. Microneedling offers gradual improvement for mild to moderate skin concerns, while subcision targets very specific, deep scar issues. Downtime. CO2 laser has the most significant downtime, followed by subcision, and then microneedling with the least. Cost and accessibility. Generally, CO2 laser treatments are the most expensive. Subcision is less so, but costs can accumulate over multiple sessions, and microneedling is usually the most affordable and accessible. Choosing the right skin treatment can significantly impact your skin's appearance and your overall satisfaction. We recommend consulting with a skincare specialist who can assess your specific needs and help you choose between CO2 laser, microneedling, or subcision. Thanks for watching, and don't forget to like, subscribe, and hit the bell for more educational information. For personalized care and tailored treatment plans, book a consultation today with one of our experienced professionals at Sparrow MD.